Nowadays, there is a great focus on how sharp or how shaped the neck can get when we do a facelift with a neck lift, or even sometimes just a neck lift in isolation. Some patients have what we call the genetic neck. The volume in the neck is due to large structures in the deep structures of the neck, which are the submandibular gland, some fat that builds up inside the muscle layer of the neck, but also some patients have very short necks. So the neck there is no length, there is no angle genetically. So these patients most of the time need to have trimming of the submandibular gland, which is what creates the most of the bulk in this area, but also need trimming of deep fat and need a platysmoplasty, which is trimming of the muscle and tightening of this muscle here in the center of the neck to create the angle. We call this the cervical mental angle. So we have this beautiful jawline that is revealed after the surgery. Also, that we combine that with a facelift most of the time because there is usually jowls happening together. So if you have issues with your neck and a jowl, usually we also need to address the face. Otherwise, the neck will be sharp, but the jowl will be still there, hanging over the jawline. And that jawline will not be crisp or beautiful the way we would like it to have. Many patients don't have a large gland, so we don't need to do anything for that. We just need to tighten the muscle, do a platysmoplasty and remove the excess skin with or without lifting the face. So for some younger patients only have the bulk in the neck, they don't have jowls yet, but they want a better angle. We can do just an isolated neck lift, but we may need to trim these deep neck structures. Now, patients that are a little bit older with jowls and laxity of the lower face, we will get the best result, the most beautiful outcome addressing both together. Otherwise, you're going to have a sharp neck with a droopy face, and that really doesn't match. And patients really don't like that look. That's why we need to combine surgery sometimes with or without trimming of the deep neck structures that are causing the bulk, the lack of shape in the neck, the lack of angle in the neck.